The patient is a 78-year-old female, lives in an independent living facility, is here at the clinic today with fatigue, mid-back pain, fever with chills that began yesterday. She is also stating that she has a decreased appetite, hasn't had any fluids or anything to eat since yesterday afternoon. She also has urinary frequency, dysuria, urgency, some incontinence, hematuria, and increased confusion and forgetfulness. She has a low-grade fever of 100.2. Her blood pressure is 178/90. She says she did not take her blood pressure medication this morning. Heart rate is 122. On exam, she has right-sided CVA tenderness. Everything else is within normal limits. Her urinalysis indicates UTI because it has the presence of nitrites, protein, and leukocytes in her urine. The UA also showed that she has ketones and glucose also present in there. The patient states she has type 2 diabetes but is not taking any medications to treat it or to manage it. My primary working diagnosis is a UTI. She's got the frequency, the urgency, the hematuria, the dysuria, the CVA tenderness. She also has a low-grade fever, lack of appetite, increased fatigue, which in older adults indicates infection. Pertinent negative, there's no odor to the urine, but her UA pretty much confirms the UTI. Alternative diagnosis, urge incontinence. She has the urgency, some episodes of incontinence, but she's got signs and symptoms of infection. So I'm thinking that it's in the UA pretty much confirms it. So it's likely a UTI. Secondary diagnoses. She has hypertension. She didn't take her blood pressure meds this morning. She's sick, probably why her blood pressure is elevated. She has type 2 diabetes, which is not being managed with any medications. And on the urinalysis kind of shows that it's uncontrolled and we need to do something about that. To probe, I would ask my preceptor, when would you be concerned enough to send an older adult patient to the hospital for management? Because I'm really on the fence with this case. And also, if it's an upper UTI, would you treat it like a complicated UTI? My plan. Again, I'm really on the fence. Like initially, I want to send her to the ER because she has a low-grade fever. And, in some older adults, that could indicate sepsis. And she's not eating or drinking. And I don't trust that if I just send her home, she's going to eat and drink and take her prescription medications, including the antibiotics. So I'm really worried about dehydration, especially if she has uncontrolled type 2 diabetes. We want to keep her hydrated, at least with something. After the infection, then we can worry about managing her blood sugar with some sort of a metformin. But if we do treat her outpatient, I would do Cipro, 500 milligrams BID for 7 days. I want to get some labs, a CBC, a CAM panel, hemoglobin A1C, and a point of care blood sugar, and have her follow up in a week if symptoms persist. For self-directed learning, I want to become more familiar with knowing when we should send patients out to the ED or when we can just treat outpatient, especially if there are multiple elements that are concerning, because I'm really on the fence with this case. I just don't trust it.